NMN 的药理作用。Pharmacological effects of NMN.
1. Anti-aging action. Aging is a natural process. And with the consumption of NAD+, the energy of organ mitochondria decreases. NAD+ is crucial for cellular energy metabolism and repair. And its reduction can impair mitochondrial function and accelerate aging. Aging is characterized by decreased mitochondrial function, DNA damage, cognitive decline, osteoporosis, immune deficiency, etc. Supplementing with NAD+ can alleviate these symptoms. Research has shown that NAD+ precursors, NMN and NR, can maintain the number of melanocyte stem cells, enhance function, prolong mouse lifespan, and open up new directions for anti-aging science. NAD+ and its precursors show potential in extending lifespan. The reasons for the decrease in NAD+ levels during the aging process and the anti-aging mechanism of NMN are shown in Figure 3. Two. Improving glucose and lipid metabolism. Currently, type 2 diabetes has generally become a metabolic health problem around the world. One of its hallmark features is insulin resistance caused by increased oxidative stress, inflammation, and lipid metabolism disorders. When pancreatic beta cell dysfunction or inability to secrete sufficient insulin, it will cause insulin deficiency and eventually lead to type 2 diabetes. Pancreatic beta cells are susceptible to the decrease of NAD+ concentration. Once the level of NAD+ decreases, it may interfere with the metabolic activity of these cells, resulting in a reduction of insulin production, which in turn increases the possibility of diabetes. Studies have shown that NMN supplementation can promote insulin release from pancreatic beta cells and increase the responsiveness of peripheral tissues to insulin, effectively improve diabetes caused by age and poor eating habits, and glucose tolerance and insulin sensitivity observed in elderly mice, opening up a new method for the treatment and management of diabetes. At the same time, NMN can also regulate the metabolism of adipose tissue, promote lipolysis and its oxidation process, reduce body fat accumulation, and alleviate fat antagonism to insulin. Additionally, long-term intake of NMN can increase the concentration of NAD+ in the body, which helps to improve the energy metabolism efficiency of mitochondria, thereby enhancing the body's energy consumption ability, reducing fat accumulation, and improving the overall metabolic rate, ultimately helping to maintain a healthy weight. 3. Improving neurological diseases. Amyloid beta protein, A-beta, plays a central role in the pathogenesis of Alzheimer's disease, AD, and is widely considered to be the main neurotoxic substance leading to AD. The abnormal accumulation of these oligomers in the brain can lead to neuronal dysfunction and cell death, which can lead to the typical symptoms of AD, such as memory loss, cognitive impairment, and so on. Some scholars have found that NMN can restore the cognition of AD model rats, and is produced by increasing neuronal survival, improving energy metabolism and reducing ROS accumulation, thereby improving the cognition and memory function of AD rats caused by A-beta 142 oligomers, and restoring NAD+ and ATP levels. Besides, some researchers have found that NMN can effectively inhibit the production of A-beta in AD mice, reduce a load of amyloid plaques in the nervous system, synaptic damage and inflammatory response, and then improve the behavioral and cognitive impairment of AD mice. The above studies also show that NMN has great potential in treating AD. Parkinson's disease, PD, is a chronic neurological disease characterized by the degeneration and death of dopaminergic neurons in the substantia nigra, leading to motor dysfunction. The production of dopamine within the substantia nigra necessitates the involvement of NAD+. Consequently, any decrease in the level of NAD+ will inevitably impact its synthesis process. However, studies have found that the expression of nicotinamide nucleotide adenyltransferase, NMNAT, is decreased in the brain tissue of PD patients. And NMNAT is a key enzyme involved in NAD+ biosynthesis. Therefore, how to promote the synthesis of dopamine in the substantia nigra of PD requires more support from NAD+ and NMNAT to help alleviate PD. Some scholars have found that NMN can reduce apoptosis and improve energy metabolism in PD cell models, thereby restoring the intracellular levels of NAD+ and ATP in cells. In addition, some researchers also found that NMNAT and NAD+ were significantly weakened in PD cells. However, after NMN supplementation, not only did malondialdehyde and lactate dehydrogenase decrease in PD cells, but NMNAT and NAD+ also increased considerably. Furthermore, the activity of silent information regulator 1, SIRT1, was increased, indicating that NMN treatment-activated SIRT1 may represent a new treatment strategy for PD. (4) The role of antivascular disorders. Vascular dysfunction refers to the functional lesions of blood vessels and nerves caused by various reasons in addition to organ damage. Blood mainly includes cardiovascular disease, cerebrovascular disease and peripheral vascular disease. Studies have shown that vascular disorders are primarily due to the imbalance between the oxidation and antioxidant systems after aging, and the accumulation of superoxide in blood vessels causes oxidative damage to the body. found that NMN supplementation can alleviate vascular oxidative stress and improve arteriosclerosis and functional impairment. Moreover, NMN reduces vascular collagen, increases arterial elastin, reduces arteriosclerosis, and delays arterial aging. This demonstrates the potential role of NMN in protecting vascular health. Furthermore, NMN also has an improved effect on cerebral hemorrhage. Cerebral hemorrhage is another neurological disease, of which about 10% to 15% of patients will further develop into a stroked state due to cerebral hemorrhage. Some scholars have found that NMN treatment significantly reduced brain edema, brain cell death, oxidative stress, neuroinflammation, microglia activation, and neutrophil infiltration in the intracerebral hemorrhage area, after NMN treatment in intracerebral hemorrhage model mice, and successfully improved the symptoms of intracerebral hemorrhage. (5) Therapeutic effect of visual degenerative diseases. The causes of visual impairment are numerous and complex. However, the cell death of photoreceptors is a common fate that leads to various visual loss and even blindness diseases. Lin et al. Found that the mouse model of retinal dysfunction showed early NAD+ deficiency, which affected the tricarboxylic acid cycle, glycolysis and SIRT3 activity. The deficiency of NAD+ leads to metabolic dysfunction and inability to cope with metabolic stress, leading to photoreceptor death and retinal degeneration. It can restore mice's glycolysis. Metoct NMN as a potential means of treating retinal degenerative diseases, and provide a unified therapeutic target and effective therapeutic approach for ophthalmic diseases. 6. Acute kidney injury and acute lung injury. Acute kidney injury and acute lung injury are frequently encountered serious medical conditions. The incidence of acute kidney injury and acute lung injury is related to many factors, but the mortality of both is high. With the increase of age, the levels of SIRT1 and NAD+ in organisms will gradually decrease. Significantly, the decrease of SIRT1 and NAD+ in the kidneys of elderly organisms will lead to an increase in the incidence of acute kidney injury. Endogenous NAD+ was considered a potential therapeutic target for acute kidney injury in older patients, and NMN supplementation was an excellent therapeutic strategy. In addition, studies have found that NMN has a protective effect on sepsis-induced lung injury in mice. The team believes that NMN promotes macrophage polarization through the SIRT1/NF-kappa B pathway to prevent sepsis-induced acute lung injury, which may be an effective strategy for preventing or treating sepsis-induced acute lung injury. 7. Protection against blood failure. Hematopoietic stem cell, HSC, is a special cell existing in bone marrow, which has the ability to self-renew and differentiate into various types of blood cells, such as red blood cells, white blood cells and platelets. In recent years, studies have shown that increased oxidative phosphorylation reflected by increased mitochondrial activity, coupled with impaired mitochondrial stress response, can seriously damage HSC regeneration. In an animal experiment to explore NAD+ stimulated hematopoiesis, it was found that supplementation of NAD+ enhancer, NMN, could increase mitochondrial clearance in hematopoietic impaired mice, thereby reducing mitochondrial activity in HSC, leading to increased asymmetric division of HSC and promoting the recovery of hematopoietic function. In addition, some scholars have found that the number of white blood cells and bone marrow nucleated cells in peripheral blood of mice increased significantly after NAD+ was given to mice after radiation injury, and the apoptosis of bone marrow cells decreased, and the immunity of mice after radiation was improved. Therefore, supplementing with NMN to promote the recovery of hematopoietic function and resist various causes of blood failure may be a new treatment strategy.